Hello, everybody watching this video. How's it going? Good morning or afternoon, whenever you're watching this. Due to some technical difficulties and a family issue I've had to take care of this week that I will email you personally about, my presentation, unfortunately, is just going to be me reading my final paper. I had a plan to go to Rhode Island College, use one of their classrooms, and set it up so where I can almost present it like a school project. Unfortunately, that is out of the picture and I can no longer do that. So yeah, this video will also be cut up into different, it will be cut up and may look a little wonky. It's just I can't read this entire thing all the way through without either me stuttering or me not liking it. So yes, I do apologize for that in advance. With that being said, and without further ado, let's get into my oral presentation where today we are going to be talking about Turner syndrome. All right, that's a pretty cool intro by me, if I do say so myself. So let's get into the topic of Turner syndrome. Now, before we dive into the topic, we have to understand what Turner syndrome is. And unless you're not Professor Ryder and you're somebody else listening to this, you may not know what Turner syndrome is. So that's why I'm here to explain it. Turner syndrome is a chromosomal disorder affecting about 1 in 2,500 female live births. It occurs when two X chromosomes, typically found in females, is completely or partially absent. This condition leads to various physical, developmental, and medical challenges. Individuals with Turner syndrome usually have normal intelligence but may struggle with spatial awareness or spiritual awareness, math, and social interactions. This research paper, we are going to explore the genetic basis, clinical presentation, diagnosis methods, treatment options, and long-term management strategies for Turner syndrome while emphasizing early diagnosis, and a team approach care. So yeah, let's get right into it. All right, now that we kind of got an idea of what my research paper is going to be about and what Turner syndrome is, let's get into the nitty-gritty of things, you know what I mean? Turner syndrome results from chromosomal changes involving the X chromosome. The most common karyotype linked to Turner syndrome is 45X, where one chromosome is completely missing. This happens in about 50% of Turner syndrome cases. Usually it's just the 45X chromosome is gone out of there. No one knows where it went. The other 30 to 40% of individuals who show Marxism, such as 45, sometimes the 46 chromosome is missing both of them, or just the 45, or partially the 46 chromosome. This happens when different cells have different chromosome makeups. Marxism often leads to milder clinical features. There also could be structural abnormalities of the X chromosome, including isochromosomes, ring chromosomes, and partial deletions. Hold on. These abnormalities, sometimes words are tricky for me, all right? Leave me alone. Usually arise spontaneously, primarily due to non-disjunction during, I have the reading level of a 6th grader apparently, prenatal mitosis, resulting genetic imbalances impacts. Okay. Damn it! Now that we understand what Turner syndrome is, let's talk about the genetic and biological biases. Wow, words already. We're starting off great. Turner syndrome results from chromosomal changes involving the X chromosome. The most common karyotype linked to Turner syndrome is 45X, where one chromosome is completely missing. This happens in about 50% of Turner syndrome cases. The other 30 to 40% of individuals show Marxism, such as 45X/46XX or 45X/46XY, where different cells have different chromosomal makeups. Marxism often leads to milder clinical features. There can also be a structural abnormalities, that word's really tricky for me, of the X chromosome, including isochromosomes, ring chromosomes, and partial deletions. These, here we go again with the abnormalities, usually arise spontaneously, primarily due to non-junction during prenatal mitosis. This resulting genetic imbalance impacts several vital genes, especially in the shock genes, found in the pre-autosomal region of the X chromosome. Shock is crucial for bone growth and development, and reduced functions can cause short statures and skeletal deformities commonly seen in Turner syndrome. The other gene of the X chromosome affects ovarian development and heart health. Disruptions of these genes can result in premature ovarian failure and heart defects such as bileusquial aortic valve and coarctation of the aorta. Hey there, let's talk about the clinical features and symptoms of Turner syndrome. The clinical signs of Turner syndrome can vary and emerge at different stages of life. Prenatal signs include cystic hygroma, generalized swelling, and heart defects seen on ultrasound. Standard features include a webbed neck, low set ears, and hand and foot swelling. As a child grows, short statures become noticeable, often resulting in adult heights that fall significantly below average without growth hormones treatment. Recurring ear infections and hearing loss are also common. While cognitive abilities are generally typical, specific learning difficulties in math and spatial skills frequently arise. During adolescence, individuals with Turner syndrome often experience incomplete puberty due to ovarian problems, leading to primarily that's a tough word for me, immorality and infidelity. In adulthood, these additional health concerns, such as osteoporosis, high blood pressure, and an increased risk of autoimmune conditions like Hashimoto's, thyroiditis, and type 1 diabetes. Fun. Not really. It sucks. So now that we know the symptoms, how does one get diagnosed with Turner syndrome? Turner syndrome can be diagnosed before or after birth. Prenatal screenings may show abnormal ultrasound results like, whoa! I'm not using this clip, so fuck you, bitch. All right, so now that we know the symptoms, how do we diagnose Turner syndrome? That's a great question. I'm answering it right now. Turner syndrome can be diagnosed before or after birth. Prenatal screenings may show abnormal ultrasound results like nasal translucency or heart defects. Non-invasive prenatal testing, NIPT, can find chromosomal issues, while a definitive diagnosis is made through karyotyping or automatic fluid or chromatic BLI. Postnatal diagnosis typically arise from physical features or growth delays. A chromosomal analysis confirms the diagnosis, and further tests such as echocardiograms, kidney ultrasounds, and thyroid function assessments help evaluate related conditions. Early diagnosis is vital for starting timely interventions. So what are some of the ways we can help support and help manage Turner syndrome? You know what I mean? So let's talk about that. Let's get into it. Managing Turner syndrome can require a lifelong care and coordinated support. Growth hormone therapy is often started in early childhood to improve height outcomes. Estrogen replacement therapy, or otherwise known as ERT, usually begins around the age of normal puberty to promote development of secondary sexual traits and support bone health. Regular cardiovascular checkups are extremely necessary due to the increased risk of heart defects and aortic enlargement. Routine thyroid functions, hearing, and kidney structure evaluations are also suggested. Fertility is often affected, but options like assisted reproductive technologies, or ART, with donor eggs can provide a chance for pregnancy under careful medical supervision. Educational support and psychological counseling are essential parts of care. Early intervention can help with learning challenges, while therapy can improve social skills and self-esteem. Support groups and advocacy organizations offer valuable resources and community backing for individuals and families dealing with Turner syndrome. Furthermore, with proper medical attention, individuals with Turner syndrome can have fulfilling lives, although life expectancy may be lower due to the heart risks and other symptoms that I mentioned previously. Early and consistent management can lessen these many health issues. Quality of life improves significantly through early diagnosis, hormone therapies, and regular health screenings and psychiatric support. While we're still researching Turner syndrome, focusing on genetic mechanisms behind the disorder, improving hormone therapies, and enhancing fertility outcomes, advances in genomic technologies offer hope for more personalized treatment plans. Advocacy organizations like Turner Syndrome Society of the United States are critical for raising awareness, supporting families, and funding research for this unfortunate disease. In conclusion, Turner syndrome is a very complex condition that requires a clear understanding of its genetic origins, clinical features, and management needs. Early identification and collaborative care approach are much needed, and essential for improving outcomes and quality of life for people with Turner syndrome. Continued research and community support are the key to empowering individuals with Turner syndrome and advancing treatment methods.